All right, good evening, and welcome to YouthMed Career Connect, an initiative from Health for Healthcare Professionals. So we're excited tonight. We have Dr. Bryan Sackey here with us, and Career Connect gives emerging healthcare leaders direct access to the professionals shaping the future of care. So each conversation opens a window into how leaders improve care, advance equity, and build new possibilities across the industry. So, in recognition of Black Mental Health Awareness Month, tonight we turn our attention to mental health equity, psychiatric pharmacy, innovation, and leadership. Again, Dr. Sackey, I will not steal his thunder. He's a board certified psychiatric pharmacist. He's an innovator. He's the founder of Mental Keys and Pharmacy Initiative Leaders, right? Did I get that right, Pills?
That's
And he
correct.
will share more about that. And Dr. Sackey, welcome to Youth Med Career Connect. How are
Thank
you?
you. I'm doing great. It is a blessing to be here on this Monday. I appreciate
Thank
you
you.
all, especially those who took the time to, gain some insight about, my journey and hopefully is inspiring to anyone else on the call. So thank you. I'm very, very humbled to be able to present to you all today.
Right, so I'm going to go on mute and then you could just hop into your presentation and then we'll do some Q&A at the end, okay?
Perfect, perfect.
All right, no
Well, like I
problem.
said, welcome everybody. My talks usually I want them to be conversations, right? I never want to lecture you all. You guys get enough lecturing either from school or parents or peers. So I want this to be more of a discussion, right? And more importantly, I want you to be able to walk away discovering yourself through your own journey, right? So I'm going to be speaking from my perspective, my journey, but as I'm going through each element of what I've experienced in my life, I want you to be able to reflect on yourself, your own journey, what you want your life to look like. What are some thoughts that you've had about, what the future may look like for, potential healthcare careers, uh, what I've done in the past, what has helped me, what may be purpose for you. So let this kind of be this era, this aura of just conversation, right? And feel free to unmute and ask anything. I know we have question and answer in the end, but if there's something that's burning, with your permission, Shelly Ann, I'll allow them to kind of just speak
Oh, for
through.
sure.
Alrighty,
This is what
alrighty,
this is for. It's an open session, giving them
perfect,
access to you. So
perfect,
that's
perfect.
perfectly fine. That's how we like it.
I love that. I love that. And I'll be asking you all some questions. Feel free to chime in. So without further ado, let's go ahead and just have a conversation, all right? Let's discover ourselves. Now, let's just start with who I am today. Currently, I am a clinical pharmacy specialist in psychiatry or a psychopharmacologist. One thing that I appreciate about that name, psychopharmacologist, one, it sounds cool. I can, walk away saying I got a degree in training in psychopharmacology, and you don't hear that too much. But I think, with my journey, it was almost perfectly aligned for who God designed me to be and where I believe I'm supposed to be. So, we'll talk a little bit more about what that is, but just to kind of give you a brief overview what I'm doing, I work at the Washington, D.C. Veterans Affairs Medical Center in D.C., obviously. That's my facility there. I operate a clinic, a mental health clinic, and breaking down the name psychopharmacology, uh, it kind of gives you the essence of what I do. So pharmacology, study of medications. We're deemed to be medication experts. Now, when you throw the psycho in front, psycho meaning psychology or psychiatric care, that is more so in the realm of mental health. So, my expertise is medication management and mental health. Now, I also always describe that even though my expertise is in medication and mental health, my role is not to push meds on people. It's actually to kind of more so be a safety guard of when is the right med to use, when is it wrong to use a certain medication. Ultimately, I want an individual to get to the best version of themselves mentally. So sometimes it may involve medication. Sometimes it's, hey, you just need therapy. Sometimes it's a combination of therapy and medications, Or all in all, it's how do we promote just a healthy lifestyle that allows you to maximize whatever condition you're going through it, but the treatment that we're providing you. Those are kind of my day to day. I work with other mental health providers, psychiatrists, nurses, physician assistants, and we're working as a team. Whether it's managing someone who is acutely ill, they come in and it's not like what you see on TV all the time, by the way. It's not like people in straitjackets. That's not what's happening. It's people like you and me who may be dealing with something that's mentally burdensome. It's hard for them to go about their day to day. And so we work together to provide treatment from what our level of expertise is. I have some other affiliations there. I'll talk about Mental Keys. That's my company that I started. That one is more so focused on actually non-medication treatment for mental health, more so looking at the keys that we can focus on in life to help us live the best mental shape possible. Not to go into too much detail, but I would say that I love the fact that I'm able to kind of operate on both sides. It's one, and what do we do before we, are in crisis? And then the other end, which is what I do at the VA, is what happens when you're in crisis and you need something more urgently, or you need something like medications, and extra support to get you through. So yeah, that is kind of my background. Now let's talk about my journey, right? That's me today, but how do we get here? Right? I didn't just pop up and I'm a psychopharmacologist. I have these, different endeavors I'm in. I didn't just get here by happenstance. It was a journey, right? And what I want you all to be able to appreciate through this process, this discussion is, the journeys are full of ups and downs. It's full. Now I'll tell you this, I probably learned the most from my downs than my ups. So I would say one of my life's quote I came up with myself. This is kind of when I was trying to get some motivation and figure out why am I doing this, right? Moments where I'm studying for hours, moments where it felt like, what's the point? I had to ask myself, what is keeping me going? And I kept repeating to myself that I have to let my passion be my drive, right? What does that mean? Then I'll pause it here and ask you all, anyone can answer, what does let your passion be your drive mean to you? And I can't see the chat, by the way. So feel free to unmute your mics. And if it's nothing comes to you right now, just reflect on it. What do you feel like letting your
We
passion be your drive?
we
Hmm.
have we have let it guide you, something you like.
There you
Like
go.
if it's something that you like, let it drive you.
Perfect. I love that. That's exactly it. That's the essence of it. Sometimes we need to ask ourselves why are we doing this, right? Your passion is something that you feel makes your life valuable when you pursue it. It makes you feel like there's enjoyment and purpose behind it. Sometimes passion comes before purpose, meaning I just really enjoy it and I really care about it. And that why are you doing this is so important to keep you going, especially when there's moments where it felt like, what am I doing? This seems like a lot of work. So that really did drive me. Now, let's kind of really start from the beginning. So for me, I'm actually Ghanaian descent. I was born in Ghana, and these are early beginnings of Bryan. I was in Ghana to the age of 5 before I moved to America, but you can kind of see some of the essence. This is the childlike version of me that's still there, hasn't gone anywhere. That curly hair is still there. It never left. But I always reflect on my early beginnings because it is the essence of you that never leaves. And it tells your story. It tells you, what are some things that you experienced early on that shaped you? My family, my siblings, um, some of the things that now today seem like, wow, how did you not have that? How weren't you able to get that? There was a lot of challenges early on in Ghana, and not in a way where we were looking for our next meal, but uh, there was a lot more effort that had to be put in to get what you wanted. And my parents truly taught me hard work. I think I was instilled that hard work when I was a kid. But either way, moving here to America, Washington, D.C., in 1995. Man, I'm telling my age. But I moved in. This is actually that picture on the bottom, middle bottom. That was my first day in America. I was 5, actually 6, and just primed and ready to explore the world, or at least American, what it's all about. Now, moving on, Washington D.C. area, still here. I've been just a DMV native, as they call it, D.C., Maryland, Virginia, and embrace all elements of it. The sports teams, the culture, the music. It's an essence of me. It's part of me, right? Now, while I was, early ages, I was trying to figure out who am I? What route do I go? So in high school, a lot of it was sort of just getting through and getting good grades, right? I was always taught try to get good grades because it can position you to to have options. So I worked as hard as I could. And I didn't have perfect grades, but it allowed me to, truly explore some options. And so I was able to get to University of Maryland, College Park, which is also in the DMV area, DC, Washington, Maryland, DC area. Now there, at first, I was looking into more sports related. I was very heavy into sports. So sports related roles like maybe physical therapy or maybe sports medicine. And it was interesting because while at Maryland, um, I didn't have the best grades. And I'll talk about that later on, but I did not have the best grades. So remember when I mentioned getting good grades helps you to, create options according to my parents. Yeah, it was rough. I think there are just so many different reasons why. As I reflect back, one of them could have been a lack of mentorship, right? I didn't really seek out mentors. I was trying to figure out on my own. I think that was the fallacy from me doing well in high school. Felt like, oh, I could do this on my own. No. That's one major lesson that I learned is to seek out mentors, seek out people that, are where you want to get to and lean on them, right? They're there to help. They're there to, provide wisdom, even if it's not talking every single day or every month, just someone available to speak to. Um, I think also there was a lack of direction from my end, not really knowing who I am or where I wanted to get to in life, right? I was letting the world decide who I was versus me deciding and determining who I was. Um, all those things sort of led to just not the best grade performance, but I persevered. I got my degree in biological sciences. Now, science was an area that I felt came easier to me, all right? Now, also, my father was a pharmacist. So I saw that. I saw what that looked like. However, interestingly enough, I didn't really want to be a pharmacist. I thought that it was boring. I saw him coming home day to day, and it didn't look exciting, right? And maybe because I didn't know too much about it, but I think more importantly, I didn't see myself in that role. One, maybe if I reflect back, did I think I had the grace or the ability to do it? So a lot of self-doubt. The other piece too, though, I don't know if my lack of knowledge within that field gave me a good perspective as to how I can fit into it. And that's where I was able to do pharmacy technician as a job at CVS. So when you go to CVS, you see those people in the back counting the medications, not the pharmacists, but the farm techs. I got a chance to work there, but it wasn't until I worked at what is called Kaiser Permanente. I don't know if you all have Kaiser Permanente in your area, but I think it's national. But Kaiser Permanente is where I saw pharmacists in the clinical setting, meaning they're working with patients directly. They're not just behind the counter. They're actually face to face with the patient. I think I aligned with that. I aligned with being able to see patients and talk to them and help them through whatever they're dealing with. So I was inspired and I said, you know what? I had this bold take in my head, like I'm gonna go into pharmacy and, really change it and improve it so that, people are aware of it and the different areas you can go into it and all this big talk. I don't know where it came from, but it helped me because it motivated me and pushed me to eventually get into Howard, despite not the best grades at Maryland. This is where I actually sought out mentors, and they gave me a really good motivation and drive, and I was able to get a good application together. And surprisingly, um, I only got into two schools. Actually, I was waitlisted for one school, and I got into Howard, and that was all I needed. You gave me a chance, bet I got you. So with Howard, I felt like I was renewed. I got a chance to restart. I was at Howard Pharmacy School. I started an organization called Pills, and I talk more about that. I was really kind of in my stride, right? And even for me, after graduating, I recognized that there was something deeper that I wanted to reach outside of just my degree. And that's where I went into residency, which is essentially you're just going to extra training to specialize in something. And for me, psychiatry was where I fell in love with, where I decided to pursue and where I fell in love with. And again, I'll talk more about how that came about. But for me, I was able to find myself within that field, and I was discovering me. So this was kind of interesting journey for me, embracing the journey. On the far left, that was me in high school graduating. Still didn't know who I was, but I felt good. I had the grades. Then second picture there in the middle, that's me in graduating from Maryland. That's where I was trying to figure it out, but I was encouraged by the fact that mentors were now in my life and helping and coaching me to get to the next stage. And then finally graduating from Howard there with my doctorate degree. I was the first doctorate level practitioner in my family. So it felt good, it felt great. And I felt proud, I was motivated more than ever. Uh, but now, what inspired my journey, right? What are some things concretely that really kind of kept me pushing? Mentors, seeing people, seeing examples of people that look like me, it motivated me, right? So I'm hoping that, as you're seeing me, if you're Black, African American, uh, Jamaican, African, whatever, if you see someone that looks like you who was in a position that you may aspire to be, it motivates you. It says, "Hey, I can get there too." So that's kind of what I used as a motivational driver. Um, Also gaps in care, right? And this is where I was able to see, man, and I think that's where that thought process of I can enhance this field or I can really kind of help to, elevate it. I saw areas where there could be improvement, right? A lot of times it linked to my community, people that look like me that I didn't think were getting the best care. Um, and in mental health, that was one of the major drivers why I got into it. I unfortunately seen too many people in my community that were struggling with mental health issues, even some loss, unfortunately. Some people that I knew that unfortunately took their lives. Um, that really kind of brought to light how serious this condition is, and just the lack of knowledge within it. So all those things really drove me, like heavily drove me to the field of psychiatry. But overall, these were some of the key things that I think kept inspiring me through my journey. So now, what actually shaped my path, right? There were some positive moments, but the negative moments, or at least the downs, right? Remember, I said there's ups and downs, but for me, I learned and grew the most through the downs. That was something that was extremely important for me as I reflected. Challenges will come. They will come. It's all about what you do with it. So I have a mindset of growth through discomfort. Um, what does that mean to you? I'll stop there again. What does that mean to you? And again, anyone can answer. Feel free to unmute. What does growth through discomfort mean to you?
Hi. We have pushed through anything that's uncomfortable because it will help you grow.
Yep. Yep. I love that. Anything else? Anyone else? That was good.
All your experiences help you grow.
Absolutely. I love those. Any other ones?
Not at this time.
Those were good. Those were really good. And what I kept hearing is just that pushing through, getting through those experiences. What I would just want to emphasize here is that they will come, right? And the discomfort, it's so key because a lot of times, if you think about it, think about moments where, or just in general, areas of your life that feels comfortable. When something feels comfortable, you don't really have to apply too much to grow or to get through it, right? And applying too much meaning that you have to learn new skills in order to get through this discomfort. When we're in an uncomfortable place, we want to get out of that uncomfortable place as much as possible. So we're going to challenge ourselves or push ourselves to get through it. And that challenge is where we grow. It can be applied in so many different settings. Think about when you first learn how to drive. I know some of you haven't started driving yet, but for those who have, think about when you're learning to drive. The first, at least for me, it was very uncomfortable. But that's because I hadn't learned how to do this yet. It wasn't comfortable for me yet. But my growth there was getting through it and learning how to drive. And so I grew because of that discomfort. I was forced to learn how to make it now a comfortable thing. I don't think about driving, but I do, but I don't think about each element that I did before. And so that was the discomfort that forced me to grow. It's the same thing with working out. You lifting weights, 20 pounds, it feels extremely hard to do so initially, but you do it enough through that discomfort, you grow and become a better person, a new person. So embrace those moments. Don't look for tough things in life, but embrace challenges, right? If something feels too comfortable, it's not that it's bad, but if you're seeking to grow, sometimes you do have to challenge yourself. And if something comes that is challenging, use it as an opportunity to grow. And so I love this quote from Malcolm Forbes: failure is success if you learn from it. So I don't really look at anything in the past as, I failed. I use it as an opportunity to grow and learn from it. And the fact that I grew from it means that it was a success. So, what are some personal challenges? School grades, I talked about that. I didn't have the best grades in the world when I went to undergrad, and I'm proud to admit that it didn't define me. Right? If it did, I would be nowhere near where I am today. Some self-doubt, as a result of those things. Am I good enough? Am I able to do this? You know, um, I didn't see too many people that looked like me, so it kind of discouraged me. Rejections. I didn't get into all the schools I applied to, for pharmacy school, for my doctorates. I told you I only got into one school, which was Howard, and I was waitlisted for another. Um, so I dealt with that. That was tough. Loss, as I mentioned, I unfortunately lost people in my life to mental health, and that was a very real thing. It did make me question a lot of things, whether I could have done more. Just a mental challenge on myself that was tough. And then community representation, that kind of goes back to not seeing enough of who may have aspired to be. I had examples here, but I didn't see too much. But also, uh, it was an opportunity for me to see if that was something we can improve on in the field that I'm going into. So when life gives you lemons, I'm sure you all heard of that, which is kind of the theme of this section here is what do I do with those things that were perceived failures or challenges or difficult moments, right? My grades, my rejection, self-doubt. For me personally, I created the organization Pharmacy Initiative Leaders, or People Initiative Leaders. The P became so interchangeable over the years because it became more than just pharmacy. It just represents people coming together who are representations of the community that we serve, and people that look like us, and showcasing that we're able to accomplish those goals. So those who are seeking to engage in a pharmacy journey, this was created to help them navigate that journey, especially those who are in underrepresented communities, right? So I took what I felt like was missing in my journey and created it for people after me, so that we can provide them that service. I wouldn't want anybody else to go through what I experienced, right? My whole goal in life mission is to make life better than where I experienced it from for the next person. So, with pills, we do a lot of mentorship or more so guidance, coaching, and this is more so we focus on those who are graduating from undergrad and looking to get into the pharmacy field or pharmacy school, and also those who are in pharmacy school trying to get into future careers. So providing pathways and avenues for them as well. So that was kind of what I decided to do with those challenges in that moment. Another one for me, as I referenced, having losing family or rather friends and people close to me to mental health, battling that, the community, what I felt wasn't really represented much when it came to mental health care. That's where I created Mental Keys. And so for that, Mental Keys is focused on, as I mentioned earlier, lifestyle habits related to mental well-being, all right? Your diet, exercise, your community, spirituality, your environment, how you interact with it. Like I mentioned, my role, my 9 to 5 here is working in the clinic for more so when things get harder to manage on your own. But I also wanted to create that lane where before we got there, how do we care for ourselves, especially people in our community that I felt, was disadvantaged when it came to mental health, and creating those spaces to learn and grow and be able to discuss mental health. So Mental Keys, recently I launched an app, and the app, it's more so on a web based, and what it's doing is essentially you take an assessment. It identifies where you are as far as your mental score, and it creates a personal journey for you to improve in all the areas that may have been low. So I'm excited to launch that and pass it on to people to better their lives. So that is, you can find that on mymentalkeys.com if you want to check it out. Now, another question for you all. And again, you can reflect on it if you don't feel like you have the answer right now, but open it up to everybody to just provide anything that they would like to kind of share in this arena. So wanted to ask, what are some challenges in the past that felt like you could never get through or overcome? And I'm asking this also because, you know, we look back and we reflect on things that felt like, man, I can never get through it at that time. But that is the key, right? Things look much bigger in the moment than they actually is. And it's important to look back and say, I did get through that. It felt like it was insurmountable at that time, but I got through it. So just wanted to give you a second to think about, were there some challenges in the past that you felt you could never get through or overcome? And this can feel more personal, so you don't have to share if you don't feel comfortable.
I see bad grades, low GPA, and recovering from it.
There you go. That's a big one. I experienced it. I've experienced it. It does not define you. So that's an excellent one for sure. Anything else?
I have death of a close family member.
I'm sorry to hear that. Very sorry to hear that. It is very challenging.
Mhm.
As I mentioned, I experienced loss as well in this journey, and it's never easy to manage it. But I always say process it. Process it. Um, Identify. Usually, it's easier later on to honor their lives through things that you may have learned through them that motivates you with your life to accomplish or push through, making them proud in that way, or just honoring and remembering them and what they represented for you in your life. But it definitely something challenging. And I'm happy to hear, at least in the context of this conversation, that you were able to overcome those feelings at that time. Those are some really good ones. And something, again, keep reflecting on that. So the final chapter here that I want to touch on is just, what is the advice? What would I tell myself, right? I think the biggest thing that I would say if I were talking to the younger version of Bryan is to know who you are so that the world doesn't define it for you. I think this is something where it took a while for me to recognize how important it is. It truly shapes your path, right? And the world today is full of so many different pieces of information that at times can determine who you are or shape who you are. If we don't intentionally do the work to figure out who you are, who am I, you'll find yourself 10, 15 years later and be like, wait, am I just a version of what other people wanted me to be, or am I who God designed me to be? So it's always, always, always important to know who you are. And I think that's something I would tell myself at a younger age. This is a quote by John C. Maxwell says, to grow yourself, you must know yourself. Simple. Sometimes people, go through life age 30, 40, 50, but they haven't really grown because they didn't really know themselves. So you just got through life, right? That's sometimes the difference between experience and wisdom. You can have experience in something, but did you learn from it? Did you grow from it? Did you figure out who you were in that process? And that's where wisdom comes in. Um, so yeah, I kind of have not stepwise approach, but just a concept of knowing yourself, right? And I do this and reflect on this every year. I look at what are my strengths? What are some God-given gifts, things that I naturally do well? Sometimes it may be things that I learned to do really well, but what are some things that I can find that's easy for me to do compared to maybe others around me, or it's just a natural gift? Strengths doesn't mean something that you love, right? I can love cooking, but it may not be my strength. So it's more so what is easy, what comes easy for you. Weakness doesn't mean you're less than. It's just being real with yourself and saying, this isn't an area that I'm the best at. It takes more effort for me to do this, and it's okay. If it's critical for my life to survive, then I'm going to work on it. But maybe perhaps a career path may not be in something that you're not the best at. We're not designed to be great at every single thing. Knowing what you're good at naturally is important. Knowing what's not that, easy for you to do is important. What are your values? What do you really care about? What do you want to see in yourself and in people around you? Is it honesty? Is it integrity? Um, is it hardworking? That earlier, what are some things that just naturally draws you? Something you can do without ever getting paid for or even acknowledged for. I just love to do it. I love playing basketball. I don't ever have to get paid for it or acknowledged. I could do it all day and I don't lose energy or interest. What are some distractions, right? What are some things that you easily kind of pulls you away from who you want to be or what's good for you? What are some attractions? What are some things that pulls you closer to the person that you want to be? All very important. So speaking of, last question here, what are some distractions for you? Be honest. What are some things that you recognize today? Like, this is a distraction. This takes me away from the person I want to be. It's kind of hard for me to pull away from. What would you say? What are some distractions for you today?
The first thing we have here is social media scrolling.
Yeah,
So we're
I
all
knew that was gonna
guilty
be in
as
there somewhere.
charged.
Uh-huh. I love the honesty. I love the honesty. Yes. Yes.
Yes. I think that's
Absolutely.
probably one for me too, if you don't put the phone
Yeah.
away.
Yeah. Yeah.
Yeah.
Yeah.
You just like,
It
let me
is tough.
focus.
Uh-huh. It is tough. It is tough.
It's a
I
different
remember
day, different age.
exactly what I was gonna say. Back when I was younger, we
Back in
we
your
didn't
day.
have this. We didn't have this level of distraction, and so I might say it's probably a bit more challenging for y'all when it comes to that part, right?
Mhm.
Identifying how to set those boundaries because it has benefit, right? I'm not going to say social media is bad. No, it has benefits. It's social
Mhm.
connection. It's a way to learn, grow as well. But then where do we find the limit, the balance, so that it's not taking us away, right? Sometimes the distractions could be you see other people and you start to compare, and that's distracting you.
Mhm.
So now you're pursuing someone else's life, not your own. So I love that answer. I love the honesty in that, and I think that goes for all of us.
Yeah.
So that's something to reflect on. But I'll leave you all with this. Life is a full circle. Embrace the journey. I, as I was doing this presentation, I really kind of honestly helped me to really sit back and reflect on some things that I engaged in or I was at one point, but now I've experienced the other side of it, right? So that first picture at the top, this was me in Ghana. I went back after, moving to America, went back with my family, young kid. I think I was barely entering high school. Um, but then fast forward, last few years, I went back to serve as one of the medical admission trips, mental health, serving the community, the youth. And this was actually in the same, close to the same area that I was in that original picture in 2004. So again, full circle moment. I'm with some colleagues that were also able to embrace that journey as well. And then this was me graduating from Howard, and then 10 years later, it's me speaking at Howard for their graduation. These are things where I never imagined that I'll be in these roles. I never thought that I could get there. I never thought that those were in line with me. I just didn't know, right? And looking at those moments where my grades were bad, I was rejected from the school, all this, things that were the downs, the challenges. I look back like, wow, now you're on that stage imparting that knowledge to other people. So I embrace the journey as much as possible. And I let my passion be my drive. Thank you. Thank you. Thank you. Thank you all. I'll open it up to questions and just any
Yes,
other
yes.
thoughts.
Thank you. Thank you. Oh, watching movies. Oh, there was another one. Sorry. Watching movies, series, or
Oh,
doing video game.
yes. Another big one. I will get caught up in a movie, a series for hours.
Binge
My day's
watching,
gone.
binge
Yep.
watching something
It's
on your day
it's the
off.
distractions. Yeah. Netflix just keeps the show
I
going. You don't have to hit next.
literally, it just picks up where you left off. You doze off, you wake up, you're at another.
Yeah, now you gotta go back and catch up.
Because
It's
like 4 episodes passed. You're just like,
my
wait, I was
goodness.
watching that. And then now you
Hmm.
end up being up the whole night because you're watching a show.
Exactly. Oh my goodness, it's tough.
Yeah, but thank you so much. We do have a couple questions here.
Yes.
Let me move the screen over. Um, all right. So what does your job look like on a normal day? I don't know if it's normal.
Yes.
We work in healthcare, so
Right, right,
whatever
right.
normal
Uh
is,
yeah, yeah, man.
like a day to
But
day.
day to day. Okay. So I'll preface it by saying what I love about my job is that no day looks exactly the same, but to kind of give a general sense, I go into my clinic. I'm looking at the patients that I'm going to be seeing for the day. I'm reviewing their charts, looking at, either the last visit, what happened, what were they on, what did they tell me was a stressor, a struggle, some of the goals we set for each other as we are trying to go through this journey of healing. All right. And because my role is medication management, I'm looking at the meds that they've tried in the past. I'm looking at the side effects that they got from it. I'm looking at, the details of their labs that says, hey, the person's kidney is working like this. Their liver may have some issues. What do we need to do to adjust it? So then the patient comes and I see them in my clinic. Hey, doctor, hey, Mr. So and so, how have things been since we last seen each other? Oh man, me and my wife have been going through it, or I lost my job, or my neighbors been tripping, and I just don't know how I'm handling this, if I'm doing it well or not. So we go through what are some lifestyle changes that they've maybe incorporated or have not incorporated yet before we even talk about the medications. Like it's like, are you exercising like we talked about? Are you getting good sleep? What's in the way of that, right? And if we can rule out all the issues that they can do on their own. I then talk about the medications and say, okay, well, it sounds like you're trying your best and you need a little bit of a push. So perhaps we can try this medication, or perhaps we can increase this dose, and then we can kind of see how things are going with that process. Sometimes it's, hey, let's get you in therapy now. I think it's time for you to consider that. Or let's get you in. I've had one in what we call equine therapy, which is horse therapy. There's swimming therapy. There's arts and craft therapy. But There's also other more serious ones that really have a instrumental role in their care. So those are kind of some of the day to day with my patients, and then talking to other providers, going through challenging cases, determining the best options, and overall seeing their journey of healing.
All right, thanks for sharing that. I think I want you to just talk just really, really quickly on like pharmacogenetics and help just the audience and these young people understand like what it is and how it helps you even select the right medication for a patient. You know what I mean? Or help with dosing and
Yes.
things like that.
Yeah,
That's
really
fairly
important.
new, if as far as
Yes.
new goes. Yeah.
Right. Yeah. So pharmacogenomics is for just to describe it is looking at a person's genes or genetic makeup, just who you are, who you're born with, the things you were born with that makes your body you, and how that can help us to determine which medications may be the best route for you. Right. And really where we are with that is it it doesn't say here's the magic bullet for you. Better describes how this medication may respond, how you may respond to it. So it's really from the safety side of it, meaning if I give you this medication and we're just trying and hoping that you get the same experience as this other person that tolerated it well, um, let's ensure that with the pharmacogenomic testing, we can make a more sound decision, right? It says that you're most likely going to have side effects if you take this medication, so we're going to avoid that. We're going to now choose this one because according to your genetic makeup, you're going to be able to tolerate this better. So that usually is what we do to guide our decisions. It's not a foolproof, right? But I think it better helps us to make more fine decisions instead of like trial and error, trial and error, trial and error. So yeah,
Yeah, because then sometimes, and then we as clinicians, we realize that that delays the treatment, right? There's
exactly.
some patients that may be on a psychiatric medication
Mhm.
and you're trying something, but because it has to build up in your bloodstream, now they're on it for 4 to 6 months with
Exactly.
no change or some change, or
Mhm.
they could have had a better result if we had utilized something, related to genes
Mhm.
and things like that. So, yeah.
Exactly.
Let me see what else this says. Oh, did you ever make a mistake and learn something big from it besides the grades?
Yeah. Yes, yes,
Besides,
yes, yes, yes.
besides the bad grades.
Yes, yes. Oh no, there's plenty. I love talking about my mistakes. One that I can vividly remember right now was when I was in residency. This is when psychiatric practice and residency was just me training to be a psychopharmacologist. I had a patient that was suicidal, and I was walking them to the mental health clinic. They were coming from oncology. So I'm walking them to the mental health clinic to be seen by a provider urgently. And I said, so this is, they were suicidal, right? They were saying, I can end my life at any point. So I'm careful about this process, but there was a lapse in judgment where I said, okay, wait right here. I'm going to go in and talk to one of the providers. And I come out, it took me about maybe like I was out for like 10 minutes trying to get them situated. I'm thinking, I'm like, oh yeah, I'm proactive. I'm going to talk to the providers and get them, hand to hand, and they're seeing right away. I come back, the patient is gone. And the police found them in traffic, pretty much trying to walk into traffic.
Walk into traffic.
And huge mistake, right? You have somebody who is saying, I want to end my life, uh, and they're willing to seek care. The last thing you want to do is just is leave them
Don't
by
leave them
themselves.
alone. Mm-hmm,
Do not leave
mm-hmm,
them
mm-hmm,
alone. Grave
mm-hmm,
lesson I learned. The patient thankfully was saved. That's why I can comfortably talk about this.
mm-hmm.
The police was able to escort them back. I was embarrassed. I felt horrible. I felt like, yeah, the self-doubt. Like, am I really cut out for this? But I got some encouragement from my mentors, supervisors, and some of the staff there. And what I did, I ended up creating a suicide safety guide for new learners, and they've been using that since. It was like a 20 page. I was motivated. I was like, I've never. So I created a 20-page
Keep your eye
suicide
on the
guide.
patient.
Yes, now I put that in bold. Duct tape yourself to that patient. Do not leave. So yeah, it was a
Literally.
huge learning experience, but I appreciate what I
Awesome.
was able to overcome from that.
Yeah. And I learned a lot of those things easily. Not easily, but early on because I started in the ED and psych
Mm.
at
Mm.
a facility right next door to a methadone clinic. So I
Okay.
started in healthcare when I was 18. So there's a
Nice.
lot of things. So I floated between the ED and psych as a
Hmm.
tech.
Hmm.
So all of that came with it.
I see.
The sexually preoccupied, the
Hmm.
suicidal, so all of those. So I learned that early and it did help me, just throughout my career because the average person has some type of psychiatric issue,
Yeah.
whether it's situational depression or whether it's situational or it's chronic,
Yep.
everyone has an issue. We're in America.
Absolutely.
But
Absolutely.
back home in Jamaica, there's no such thing as mental health, right? Sure, no,
Mhm.
but no, we know better, right? We're
Yeah.
living in this day and age in 2026, but that helped shape a lot of just what I do in my career and how I approach and how I treat patients and how I'm even able to interact with patients when we see them in a clinical setting, uh,
Right.
because there's some kind of underlying issue. But
Right.
everyone can't deal with a psych patient. So that's another thing I want you all to realize when you're listening to this conversation or those of you watching right now, everyone can't deal with it. It takes a special person. We have different specialties for a reason.
Yeah.
So you get chosen or the path or the specialty chooses you
Yeah.
along the way. And that's something that you learn from. And it's one of those things that is a challenge or something, but it'll help you grow. Just like he'll
Absolutely.
never forget. And now he turned it into something else. He wrote a whole playbook
Hmm.
and
Hmm.
everything like that. But those are the
Absolutely.
types of things that help us grow as clinicians, for sure.
Yeah. And I think one last point to that, don't
Mhm.
let mistakes confuse you as to whether this is for you or not. You could be an expert in something eventually, but mistakes can occur, right?
Mhm.
It's all about like how you respond to it. Reflect, see how it got to that point and correct it, but
Mhm.
don't let mistakes kind of define whether this is the right journey for you or not.
Yeah, for sure, because it's definitely all a part of the journey. And
Mhm.
and one of the things you mentioned earlier about learning, so it's not necessarily a loss because it's what you
Hmm.
learn from it. It's
Hmm.
what you learn from it and how you move forward.
Absolutely.
So yeah, I think we have two more.
Mhm.
All right, if you had to start over today, what would you do differently, if anything?
You know, I'm actually a big believer of never regretting any aspect of my journey, right? My spiritual faith, Christianity, and just that background, I've learned to grow that every single step in my life was for a reason, and God is writing my story, right? And I can have moments where it felt like, oh my gosh, like this, I should have done it differently, or I could have done it differently. And guess what? Sometimes you get stuck in that. Like, if I had only done this, I had only done that. But your journey is for a
Your
reason.
journey.
Even the
Mhm.
mistakes you made, it guided you into the version or the person you are today for a reason. We don't know what the other option would have looked like. Sometimes it would have felt like the right option, but it could have led to a much
Mhm.
worse outcome. So I try not to live in that mindset of what I would have done differently. I think there are moments and things I would think about and say, hey, I wish that I sought out mentors earlier, right? Like I mentioned, when I was an undergrad, that would have changed the grades I ended up getting, or sought out help. But also, I may have never created pills because
Mhm.
that experience is what taught me and inspired me to like create something so that other people don't have to go through that. So
Yeah.
I embrace every element of my journey, and it's hard for me to say I would take anything back or do it differently.
Okay. Okay. Right. Well, that's a good answer. That's a fair way to look at it. Um, all right. So this last question, and I don't know if Maushi has any questions, but this one says, how do you protect your well-being in your line of work? And how do you juggle it all? Those are two very loaded questions. You can take
Yeah.
them one at a time. Your well-being.
Yeah, so well-being and self-care. I That was something I did not embrace before. As a student, you're pursuing your doctorate degree, all those different things that I was getting into. I did not take care of myself at all. And again, I think I also I was doing a lot of things for other people, and not knowing myself probably affected some routes that I didn't even need to take. But self-care was something I embraced as I got older. And for me, that's when I get off of work, I have to go to the gym. That's a decompressing activity for me. Mentally, physically, recharges me. Um, I have to travel. I have to see the world. I have to, look at life outside of my ecosystem. I have to have my community, family, friends, regularly engage and make time for them. That's just a key part of my self-care. So it's non-negotiable. Like no matter what I do, if I add something on my plate, usually I'm moving something out professionally, but I
Mhm.
never budge on my self-care and my family and the things that are personal to me. Those things are fixed. So that is kind of how I do it. I set boundaries. And that answers the second question, honestly, is setting boundaries. How do I balance
Mhm.
everything?
Mhm.
If I add something, I have to ask myself, does this align with who I am and what I care about?
Mhm.
And if it
Mhm.
does, then I have to reflect on what am I doing that doesn't really align with me or no longer serves me, and I either can pass it on to somebody else or slowly disengage in a professional way, right? I'm not going to just ghost another organization or company, but it would be like maybe this is my time to determine this new opportunity aligns better with who I am and where I want to go. And
Mhm.
so I'll have to kind of step back on this other thing. So know my capacity. I can't fit everything on my plate.
Mhm.
But when I do, what I would do have on my plate, I have to make sure that it aligns with me. It's something that feeds my appetite.
Okay. And I am so glad this evening aligned with you. I know you're,
Yes.
hold on, let me see. If you had 30 seconds to inspire the next generation of healthcare leaders, what would you say?
Discover yourself, know yourself, know yourself. That is so important. I've been saying all this talk. That's the title of my conversation. Know yourself. It
Know
is so
thyself.
important because there's so many different elements of the health care field, and so many different pieces. You could be in the same exact field, same profession, but if you don't know who you are, you get caught up in that, right? And try to figure out why you're doing something, pursue that passion. Not everyone is destined to be this, not everyone's destined to be the great Shelly Ann, Dr. Shelly Ann. Let's not play
Oh,
around.
nice. I like how you
Yeah.
threw that in.
Uh-huh. Uh-huh. Not everyone's destined to be Dr. Sackey. I wouldn't want you to be me. I want you to
Mhm.
be yourself, pursuing a field that matters and it's personalized to you. So just know who you are and always be on that constant journey.
I actually have one from Mousy. Mousy says, how did you know that you wanted to work in healthcare? Was it I know she had joined a little late, but how do you know you wanted to work in healthcare? What was it, a moment or something you've always wanted to do?
Yeah, I think the quick answer to that is I had to figure out what was coming easy for me, what aligned with my strengths, my gifts. And I recognized in school, the sciences, biology, those things came way easier for me than math. Even the English classes, they didn't come that easy to me. So it's something as simple as figuring out what aligns with you, and then a combination of seeing it. I saw it, I engaged in it, I tried it out as a youth, and I found that there was a joy in it. It felt like home. It felt easy. Now, what element of a space in healthcare, that took some time, but I knew that this is the arena that aligned with who I am and who I was designed to be. So no aha moment, but it does take a lot of trial, like actually engaging in those experiences, talking to people who are in that field, see if it interests you, right? And that can help you to determine if this is for you or not.
Let me see if there's anything. All right, so I don't have anything else in here. But I just want to say thank you, thank you, thank you so much,
Of
Dr.
course.
Saki, for sharing your journey, your expertise, and your commitment to mental health equity to the youth, the next generation. We do a lot of
Absolutely.
similar work. You started it
Mhm.
on behalf of aspiring pharmacists, and we're doing it on behalf of all the other healthcare professions out there. We know that there's a critical healthcare workforce shortage, so we're doing what we can in our neck of the woods to make sure that
Absolutely.
we continue to inspire the next generation and give them the tools and
Absolutely.
equip them with what they need,
Yep.
and let them know that we're always here. So sometimes people don't understand that even simple open access sessions like this is situational mentorship, right? So
Yep.
for those of you who listen, this is situational mentorship. You connect with Dr. Saki, whether it's on Instagram or LinkedIn or something. 3 years from now, you might be able to reach out to him and say, "Hey, you spoke to me on the Youth Med conversation and something, Dr. Sackey, so and so," and you can ask him a question, and he's right there to answer it for you. There are people like Dr. Sackey and myself, again, along the lines of the boundaries and everything, but we're happy. It gives us joy to pour into you and to help you navigate this journey. So to our students that are on the call, and for some of the new ones that might be listening, when we replay this, just continue to stay curious, ask bold questions, know thyself, right? Know
Hmm.
thyself. Make sure that you're asking those questions. If you're uncertain, seek out a mentor. We're here for you to help you to continue to grow and just continue to build the different relationships with professionals in our different healthcare spaces, so that you can have the right resources that you need to continue to grow. And we're here till graduation. We're here till
Hmm.
graduation. We're here to follow you. We're here to come to graduation, right? So just keep in touch with our network and in our community. And on behalf of Help for Healthcare Professionals and our sponsors tonight, Merge Caribbean Cuisine, thank you for joining this Career Connect conversation where mentorship meets medicine and exposure becomes empowerment. Thank you so much, everyone, for joining. All right. Good night.
Take care, y'all.
Yeah. All right. Thanks. And then we'll crop it up and we'll send it over to you. Okay.
Sounds good.
But
Thank
thank
you.
you so much. Appreciate it. Now I done
Yes.
interrupted your gym time.
No, you're good. You're good. You're good. I'm getting it. I'm gonna get it in.
No problem. That's that discipline.
There you
All
go.
right. No problem. All right. Take care. Hold on. Let me make
Take
sure.
care.
Did Maushi have anything else? All right. No problem. All right. I see hearts and stuff. All right. Thank you so much. All right. Take care,
No
Dr.
problem.
Saki. All
Take
right. Bye
care.
bye.
Bye.
Mhm.